Good afternoon. My article over the weekend was entitled Wuhan Coronavirus NCOV 2019 Coronavirus. President Xi warned the coronavirus is accelerating and the country is facing a grave situation. At the last count, Sunday, 26 January 2020, and I'll give you a link to the latest update, more than 2,000 people globally have been infected, the vast majority of them in China, where 56 people have died from the disease. I, for one, believe this number is massively undercounted. Some reports speak to 100,000 infections in China. It looks like it started around or before December the 1st, and that it can take up to 23 days to show symptoms. Curiously, Bill Gates has been telling us a pandemic was coming. In October 2019, he ran a simulation of a coronavirus pandemic. Just 3 months later, the real coronavirus pandemic begins. There is an article in Business Insider in October last year where Bill Gates said the following. He thinks a coming disease could kill 30 million people within 6 months, and Gates presented a simulation by the Institute for Disease Modeling that found a new flu like the one that killed 50 million people in the 2018 pandemic would now most likely kill 30 million within 6 months. The likelihood that such a disease will appear continues to rise. New pathogens emerge all the time as the world population increases and humanity encroaches on wild environments. It's becoming easier and easier for individual people or small groups to create weaponized diseases that could spread like wildfire around the globe. According to Gates, a small non-state actor could build an even deadlier form of smallpox in a lab. So, who had mutated bat snake flu as their top market risk for 2020, tweeted Tracy Alloway. The precise origins of the coronavirus are yet to be established, with Wiley's Journal of Medical Virology saying it may be snake-to-human transmission, and some even pointing the finger at the Wuhan Institute of Virology and the Wuhan Biosafety Level 4 BSL-4 laboratory, and surmising that the only explanation left is artificial DNA modification, possibly by that same Wuhan Institute of Virology, which since 2007 has collected samples from thousands of bats across the country and done genetic experiments with them. What is clear is that the CCP suppressed information until we reached a Groucho Marx "who you're going to believe, me or your own eyes" moment. Epidemiologists speak of tipping points. Malcolm Gladwell described the tipping point as the name given to that moment in an epidemic when a virus reaches critical mass. It's the boiling point. It's the moment on the graph when the line starts to shoot straight upwards. In an article in 2014 about Ebola, I called it the moment of escape velocity and wrote viruses exhibit nonlinear and exponential characteristics. The mathematics is the basic reproduction number of the infection, R_0, which represents how many people each person infected with the coronavirus is passing the disease onto. A number of less than 1 means the virus dies out. For a frame of reference, the typical RO attack rate for the seasonal flu is around 1.28. The 2009 flu pandemic, 1.48. The Spanish flu, 1.8. The RO range is somewhere between 2 to 2.6, with Eric Ding speaking of 3.8 over the weekend, and then he was slammed down, but now predictions are even higher. Dr. Eric Ding tweeted, "The new coronavirus is a 3.8. How bad is that reproductive RO value? It is thermonuclear pandemic level bad. Never seen an actual virality coefficient outside of Twitter in my entire career," before adjusting his calculations lower to 2.5. Each person infected with the coronavirus is passing the disease on to between 2 and 3 other people, now higher. On average, at current transmission rates, according to 2 separate scientific analyses of the epidemic. Of course, there's the mortality rate. Ferguson's team suggests as many as 4,000 people in Wuhan were already infected by January 18, and that on average each case was infecting to 2 or 3 others. A second study by researchers at Lancaster University also calculated the contagion rate at 2.5 new people on average. Should the epidemic continue unabated in Wuhan, we predict it will be substantially larger by February 4, the scientists wrote. They estimated that the central Chinese city of Wuhan, where the outbreak began in December, will alone have around 190,000 cases of infection by February 4. Now, if you take my numbers, we're going to be way through that. And that infection will be established in other Chinese cities, and importations to other countries will be more frequent. The Lancet now reports that the coronavirus is contagious even when no symptoms, specifically crucial to isolate patients, quarantine contacts as early as possible because asymptomatic infection appears possible. The overarching point is that whether it's 2.5 or 3.8, this is off the charts. The CCP is building hospitals in a record-breaking 7 days, but who will man them? China has locked down a total of 47 million of its citizens. Given the new hyper-connectedness of the world, for example, did you know there is a daily Ethiopian flight between Wuhan and Addis Ababa? As of Thursday, Ethiopian Airlines, which has further multiple daily passenger and cargo flights to China and is Africa's busiest airport hub, said it was waiting for guidance from Ethiopia's health ministry on how to respond. I have to assume that the coronavirus is already in Africa, but just not diagnosed. That's a racing certainty. On Sunday, they said there was a case in Ivory Coast. Paul Virilio wrote, "With every natural disaster, health scare and malicious rumour, now comes the inevitable information bomb. Live feeds take over real space, and technology connects life to the immediacy of terror, the ultimate expression of speed." And in his book, City of Panic, he described the city reconstructed through the use of mediatized panic. Markets bought gold and G7 bonds on Friday as investors dived into safe havens. Next week, we could see these moves turn parabolic. It is a curve each of them feels unmistakably. It is the parabola. They must have guessed once or twice, guessed and refused to believe that everything, always collectively, had been moving toward that purified shape, latent in the sky, that shape of no surprise, no second chance, no return. So, reference points. This is a tweet from First Squawk. Chinese health authorities are struggling to deal with a skyrocketing rate of infection as the number of coronavirus cases increased 50% in just 24 hours. And there's going to be a lot more of that. Researchers from Johns Hopkins created a tracking map of the coronavirus. That link is on Rich Wrap-Ups if you're interested to track the numbers. President Xi warns the virus is accelerating, country facing grave situation. That was from AFP. Jorge Guajardo, I'm thinking of my Georgetown University undergraduate class, Modern Foreign Governments, with Dr. Arturo Valenzuela, where we learned that unforeseen natural events are the biggest threat to authoritarian regimes, e.g. pandemias. And that's another important point. The ominous incidence curve estimates the trajectory of the virus based on R2.6. This is from Dr. Eric Ding. His tweets, Holy Mother of God, the new coronavirus is a 3.8. How bad is that reproductive value? It is thermonuclear pandemic level bad. Never seen an actual virality coefficient outside of Twitter in my entire career. So that estimate was 3.8. Estimate also that only 5.1% of infections in Wuhan are identified. That's the other important point. Should the epidemic continue unabated in Wuhan, we predict that the epidemic in Wuhan will be substantially larger by February 4, 191,529 infections. I think that's a low ball count now. Infection will be established in other Chinese cities and importations to other countries will be more frequent, our model suggests. Travel restrictions from and to Wuhan city are unlikely to be effective in halting transmission across China. With a 99% effective reduction in travel, the size of the epidemic outside of Wuhan may only be reduced by 24.9% on February 4. A basic reproductive number for this 2019 nCoV outbreak is higher compared to other emergent coronaviruses, suggesting that containment or control of this pathogen may be substantially more difficult. Summary, so what does this mean for the world? We're now faced with the most virulent epidemic the world has ever seen. A 3.8 means that it exceeds SARS' modest 0.49 viral attack by 7.75, almost 8-fold. A virus that spreads 8 faster than SARS, cannot be stopped by containment alone. Possibly an unchecked pandemic that the world has not seen since the 1918 Spanish influenza. Then he reiterates the typical RO rate for the seasonal flu is around 1.28, flu pandemic 1.48, Spanish flu 1.8. Lancet, of course, reporting that the coronavirus is contagious even when there are no symptoms. Now, BioRxiv is saying the latest coronavirus RO estimate from 3.3 to 5.47. Conclusion, the mean estimate of RO for the 2019 CNOV ranges from 3.3 to 5.47, significantly larger than 1. China's Health Commission Minister revealed on Sunday that the incubation period was 1 to 14 days and that the virus was infectious during its incubation period. Chinese Premier Li Keqiang told medical staff at the Wuhan hospital, I'm here to cheer you up. Please protect yourselves while treating patients. People of Wuhan are protesting on the streets. Police began to crack down with baton and shield. That's from Albert Batlayeri. The link is there as well. There's a video of people collapsing on the streets in China. That's from Russian Market. And then a very, very good analytical paper by NN Taleb, The Problem with the China Coronavirus, Fat Tales and Naive Empiricism. reproductive ratio estimate of the virus's reproductive ratio, that is the number of cases one case generates on average over the course of its infectious period, in an otherwise uninfected population are biased downwards. This particular small sample property comes from fat-tailedness of the process. Simply, RO is estimated from the average, which takes longer to converge than other fat-tail-based methods, as it is itself a fat-tail variable. Spreading rate, historical measures of spreading rates for pandemics in general and for the current one in particular underestimate current spread of the disease because today's conditions reveal more connectivity than past numbers. Global connectivity is at an all-time high, with China representing one of the most globally connected societies. Fundamentally, viral contagion events depend on the interaction of agents in physical space, and with the forward-looking uncertainty that novel outbreaks necessarily carry, reducing long-range connectivity temporarily to slow or pause flows. Conclusions, standard individual policy approaches such as contact tracing and monitoring are rapidly overwhelmed in the face of mass infection, cannot be relied upon as an effective mitigant of the pandemic. So, very well worth reading that in full. He calls WHO rent-seeking idiots, and truly they are. They're waiting for permission from China before they even release medical analyses. October 2014, when I was writing about Ebola, I said it's about its escape velocity. Viruses exhibit non-linear and exponential characteristics. It's a numbers game. The more cases you have, the more likely there are going to be mutations that could change the virus in a significant way. There's a 10-minute video where Taleb explains naive empiricism, terrorism, and Ebola. The point is that you can be wrong a zillion times. Doesn't matter if at all it takes is once to hit extinction. This is the comparison people make about driving on the road and getting in a car crash. It's remarkable how people who learn statistics become dangerously stupid, like this professor. Car accidents are thin-tailed, never multiplicative. WHO is working with a network of specialists to analyze 2019 NCOV full genome sequences as they become available. We have not received evidence that the virus has changed. Listen to this. We await further information from Chinese officials. 23rd of December, I was saying a complex, non-linear, interdependent world where feedback loops can start spinning at dizzying speed. The last futurist, Wuhan virus, living in an era of misinformation. I'm not usually a peddler in conspiracy theories, but China's slow action and blatant misinformation campaign regarding the Wuhan virus in December and for the better half of January got me wondering about what is really ground zero for the virus. You can always count on the internet for rumors and theories, and one that I think makes the most sense is not transmission from bats to snakes to people. A more likely origin is the Wuhan Virology lab itself. And I think that's correct, because otherwise why would they have delayed any mention of this for so many days? Paul Virilio, I was referring to, his book City of Panic is a masterpiece. The city reconstructed through the use of mediatized panic. Revelation 6:12-13, when he opened the sixth seal, I looked, and behold, there was a great earthquake, and the sun became black as sackcloth, the full moon became like blood, and the stars of the sky fell to the earth as the fig tree sheds its winter fruit. Luke 21:11, there will be great earthquakes, and in various places famines and pestilences, and there will be terrors and great signs from heaven. The link to Chico Not Groucho, who you're going to believe, me or your own eyes. And separately, let me finish off with this, could be the first case in Africa. Authorities in the Ivory Coast said a passenger from Beijing that landed in Abidjan on Saturday showed symptoms and was being tested for the virus. It is a racing certainty that there are huge numbers of infections here in Africa. That's a fact. Thank you for listening.